You have already done the impossible. You faced cancer, you took the treatment, and now you're standing strong. The society tells us the life after cancer is about picking up the pieces, coming back to who you really were, and try to build back that life that you lost with cancer diagnosis. But I completely disagree with that. Life after cancer is about trying to build that better life with all those experiences that you experienced, being terrible or beautiful, all along the way during the fight for cancer. You are now 1 in 18 Americans who have been cured for cancer and carry that resiliency that the world around you may not completely understand. In this video, I'm going to show you 5 realities of survivorship, from physical changes to power of exercise, to help find the keys to live a better and richer life after cancer. My name is Dr. Michael Chovanec, and I'm a professor of oncology. One of the main areas that I focus on is cancer survivorship. The reality number 1, physical changes. Your body is going to feel different after the cancer treatment. Me and my colleagues summarize the most common physical and mental changes that survivors are going through after treatment. First, you can come across visible changes on your body. You may have lost a breast, you can have a lymphedema, you don't have a testicle. There are physical mutilations damaging your body image. So yes, this one is definitely a tough one. You are adjusting to new you with losing a part of yourself physically. You can have all sorts of different other problems. Very common is neuropathy. Neuropathy is if you are receiving chemotherapy or radiotherapy, so you're getting a treatment that can be damaging your nerves. I also want to touch on a problem of fertility. A lot of patients are treated for cancer in their fertile age, so normally in their lives they would be able to have children at that time. The cancer treatment may not necessarily damage your ability to have a child, and you should fight for that. If you have been diagnosed with cancer at the moment, always ask for the way to preserve your fertility. For men, we can take that sperm, put it in a biobank, freeze it deeply, and you can come back to that biological sample and use it to produce your offspring with in vitro methods of fertilization. Same goes for the women. If you were diagnosed with breast cancer or any other type of cancer that may damage your ability to have a child, always ask your doctor about the possibility to preserve your fertility. There are ways to do it. The reality number 2, anxiety. This goes even without saying. If you tackle the cancer, if you survive the treatment after the cancer, and your doctor tells you you are cancer-free, there is always toll on your psychological health. It is natural to worry about that cancer recurrence, about the cancer coming back. And patients and survivors deal with this every day. There's this so-called Scanxiety. So if you're going for a next CT scan to confirm you don't have a cancer, months or years after treatment, you are always sweating and can't sleep weeks, maybe even months before taking that scan. Some survivors are reporting cognitive function loss. This means how well you can process thinking, how well you can process logical tasks, how well you can process your own emotions. This problem has been overlooked in the past because this is highly subjective. Whatever you feel, I don't have to see as a doctor. So always make sure to communicate to your oncologist or primary care physician, I have these issues, I want to address them. A lot of times, patients will be worried to talk about the problem. Example is sexual health. Our patients and our survivors after treatment, they have those sexual health issues. The men may lose the ability to have an erection, so they are losing the ability to have a normal sexual intercourse with their spouse. Women survivors can have those dry linings in their vagina, so it's even painful to have a normal sexual relation with their partner. These are the issues that absolutely can be addressed and they absolutely can be helped. So be sure to always talk to your physicians about your problem. Reality number 3, social shift. I can see that in my clinic almost every single day. The patterns are shifting, relationships are changing. Sometimes even our own close ones struggle to fight the cancer with us. Our friends may have difficulties to looking at us suffering, or they just can't handle the pain themselves. Be ready to lose some friends along the way. This is normal. It is hard to blame anyone, but I have positive news for you. Be also ready to meet a plenty of new friends, to create new social networks, to bring people together. I'll give you an example from my own life and practice. Last week, I was going for a morning jog after my 24-hour shift in the hospital. The weather was foggy, and there was just one runner running in the opposite direction. And she says, "Hey, Dr. Michael, I'm your patient. Do you remember me?" She's actually a physician too, but she has tackled 3 cancer throughout her lifetime. And she says, "I remember you telling me if I exercise more, if I do a little bit for myself, and I do some physical fitness training, I may feel better and my life can change." I have been living on a borrowed life for the past 10 years, trying to hold on for one more year before my kids get in school into a higher level, before they graduate. But now my kids are grown up, and I feel I'm starting to breathe and live again. Let me tell you, I felt so warm inside. It was very emotional for me. This was the best proof that our work matters. And we're naturally transitioning into reality number 4. You can absolutely get better and feel better. After cancer treatment, you can feel the burden of that chemotherapy for years. And doctors struggle to find solutions. Of course, you should get a therapist, you should talk to your family, you should try to live the best life you can. This is what I'm telling my patients and survivors every day. The reason we are trying to cure you and the reason we're treating you is for you to live a normal, happy life. So you should start to look at yourself as a healthy person. You may have some health issues, but we have to work with them. Science shows us that the single most impactful tool that we have is physical exercise. There's increasing knowledge in the scientific world that if you take that physical exercise 3 times a day, you go lift weights, you jog, you run, you do the hiking, whatever feels natural for you, but always remember to include that strength training. That's what a lot of people is forgetting. If we stress our muscles in a good and healthy way, if we try to make them stronger, not only we are going to feel better about our body image, feel physically well, it's going to affect our mental health as well. Muscle is also an organ. If you exercise the muscle, it releases a lot of good stuff in your bloodstream. Those are the substances that suppress that unhealthy inflammation. Those are substances that have anti-cancer effect. We now have studies that people who exercise can lower their risk of cancer. They can even lower the risk of cancer coming back after being cured for cancer. So there you have it. The life after cancer can be tough, but there are ways to improve this. And I wanted to make this video hopeful and energetic for you. And we're going to reality number 5. Cancer and survivorship is a lifelong journey. This means you have to constantly work on your health. This means proactive approach all the time. And this also means that all that activity matters and can make your life better. You probably remember I suggested to create your own home team. Now I suggest to keep that home team. You have selected people that went through with all the troubles with you, and you want to build on that in your present life. Those are the people that will be there for you no matter what. Survivorship is the second act. It's a new beginning. If you are ready to take control, you need to be aware about your specific condition. If you want to know more about my specific field of expertise, watch my next video, The Complete Guide to Testicular Cancer. If this video gave you hope, please subscribe. I'm happy you're here.